Two things, inferior colliculus and superior colliculus in the midbrain, the next structure. The inferior colliculus is auditory, superior colliculus is relaying the information of the visual information. Okay, I remember that when you see something you believe more, so the visual informations are superior. Auditory can be always deceiving. You will anybody can cheat you by means of giving a fake calls. So auditory means inferior. So I remember this: superior colliculus for visual stimulus, inferior colliculus for the auditory stimulus. Okay. Next is your internal capsule. So the internal capsule, this area is called as the internal capsule. You can see the fibers from all parts of the body are coming. So all parts of the cerebral cortex are coming in a radiant manner. This area is called as the corona radiata. All these fibers condense here. You can see this condensing area like a boomerang shaped structure. This is called as the internal capsule. If you want to see the internal capsule in the MRI or the cross-section study, you can see this here in this part. This boomerang shaped structure is called as the internal capsule. So for an internal capsule, who are all the adjacent areas? Thalamus is the adjacent area. Basal ganglia is the adjacent area. Most of the basal ganglia nucleus are located near the internal capsule. Your lentiform nucleus and the caudate nucleus are very close vicinity to the internal capsule. So next is your periaqueductal gray matter. This you might have studied in your Clayton's electrotherapy, that this periaqueductal gray matter is a very important structure in the pons, which activates the descending pain suppressing system. You might have known about the Raphe nucleus, periaqueductal gray matter and the Raphe nucleus, which activates the descending pain suppressing system, thereby reducing your pain in the body according to the pain gate theory by Melzack and Wall. So they are located in the pons, and they are one way or other responsible for the release of the endogenous opiates called endorphin and enkephalin. So they are going to modulate your pain experience, and they are very important centers for pain. So next is your basal ganglia. We have already seen enough about basal ganglia. So the gangliocapsular region is nothing but the combination of the basal ganglia and the internal capsule is called as the gangliocapsular region. Last but not least is your pineal body. The pineal body is the one. Okay. So the pineal gland is located here. Okay. So this is the pineal gland. And what is the role of the pineal gland? It regulates some of the hormones in your body, which are sexual hormones. And very important hormone it regulates is your melatonin. Melatonin is best known for its role to play in regulation of sleep pattern. If you have insomnia, there may be a problem with the pineal body. So sleep pattern is being disturbed these days when you are sleeping in an abnormal timing, and that can invariably influence the hormones of your body, particularly the hormones like melatonin and sexual hormones in your body, because the regulatory center for sleep pattern, I'm not saying about the sleep, it is sleep pattern, and the melatonin and other hormones is the same